Hello everyone, I am Dr. Santosh Kumar, founding director of Momentum Ortho Care, Kolkata. This Momentum Ortho Care is a team of highly dedicated and highly capable orthopedic surgeons and other healthcare professionals with the sole aim of bringing the best orthopedic treatment, especially joint replacement, right here in Kolkata to your doorsteps. Whatever is most advanced on this earth is available right over here and very much accessible and very much affordable. For this, we have discussed several issues. Today, we'll be discussing some issues pertaining to knee replacement. Knee replacement, as you know, is pretty common because primary osteoarthritis of knee means wear and tear of knee. Our knee wears out the way our car tires wear out. It leads to pain and increasing deformity, that is bending of the knees. Now, this bending of the knees leads to instability, that it leads to instability, and in severe cases it leads to risk of fall. It leads to fall leading to other injuries, especially fracture and femurs. So osteoarthritis leads to pain and instability, and this instability may lead to fall. Now the issue with osteoarthritis is that there is no medicine as such for this. There is no proven medicine. What happens in osteoarthritis is like this is our knee joint. So this is a thigh bone, this is the shin bone, and the joint wears out. So this is the smooth surface of the cartilage, the ligaments, the meniscus, all these things wear out. So this wear out leads to pain and increasing pain and instability. It wears out like this. This is the way it wears out. It leads to increasing pain and instability, but unfortunately there is no medicine, and this is progressive in nature, means it will gradually increase with time. So we need to do knee replacement. Knee replacement is basically resurfacing of the worn joint. So this is the worn out surface. So this worn out surface is exchanged with a new surface. So new surface is put. So this is known as knee resurfacing or knee replacement. Knee resurfacing or knee replacement is primarily the same thing. Knee replacement is about replacing the diseased part. If a person opts in relatively good in time before fixed bending has appeared, then we can do something called unicondylar knee replacement or partial knee replacement. In this, only the diseased part is replaced, leaving the other parts intact, and the implant is very small, like a tiny coin, and the recovery is really fast and the feeling is really natural. After partial knee replacement, also known as unicondylar knee replacement, the person walks from the very same day of surgery and can join office by 2 weeks. Now, what is this unicondylar or partial knee replacement? It's not half knee replacement. Partial knee replacement doesn't mean half knee replacement. It's a different concept. In total knee replacement, the whole worn out surface is replaced by a new surface, and this is resurfacing and realignment. The knees which should be straight have bent like this or this, and then it is realigned. Hip, knee and ankle are brought in one line. So this is knee replacement or knee resurfacing. This is either total or partial. In total knee replacement, we replace the complete surface and we realign the bent knee. In partial knee replacement, we replace only the diseased surface. We leave the other part intact, and we leave the ligament intact. So this leads to very fast recovery because the implant is really small, and it leads to more natural feeling because we preserve the natural parts of the joint. So it is selectively targeted treatment. We cannot do partial knee replacement once the arthritis is very advanced, or there are certain criteria for doing partial knee replacement. Whenever the knee bends from standing, but it straightens from lying down, then only we can do partial knee replacement. Once the knee is bent on lying down also, that is known as a rigid deformity, then we have to do total knee replacement. Now this decision whether to do total knee replacement or partial knee replacement can be best left to the surgeon and not to be taken by the patient. Because in our country, surgeries are very late, quite late. By that time, the knee is already bent like this, and it is rigid bending. It is not correctable bending. And then we have to do total knee replacement. So total knee replacement is still the gold standard. with partial knee replacement coming as a additional option in selective cases where it can give better results. It has got certain advantages like faster healing, much less blood loss, and of course natural feeling. But it cannot be done in all cases, and that decision can only be taken by the surgeon, which is the apt surgery for the patient, whether partial or total knee replacement. Now, knee replacement implants are all cemented implants. They are put with bone cement. That is, this is the real implant. This is the real implant. For example, this is put on the surface. This is put on the surface with something called bone cement. So the bone cement sets within 10 minutes, and it gets its maximum strength right on the table itself. So we mobilize, we make the patient walk with the walker from the very next day of surgery. We can do one knee at a time, or we can do both knees in single sitting. Even if we do both knees in single sitting, we make the patient walk from the very next day of surgery. We normally keep the patient for 3 to 4 days if it is one knee, and when we do both knees in single sitting, we keep for 5 to 6 days. Now, once we do both knees, I prefer to do it in single sitting because my operative time is 15 to 20 minutes, and if we do in single sitting, it's medically one surgery. If you give a gap of 3-4 days, then or 2-3 days, then it becomes two surgeries, very tightly packed together. You are giving anesthesia twice, you are giving IV fluids twice, you are giving injections twice. So there is more stress on the body. If you give a gap of 2-3 days, then it's better to do in single sitting, provided that the team who is doing the surgery, the surgeon and his team is capable of doing the surgery in single sitting. Otherwise, we can do one knee and give a gap of minimum of 1 month up to 1 year, and you can do the next knee. So that is also a good option, to do one knee and give a gap of minimum of few months and do the other knee. So that is a good option. The recovery time, it depends on the muscle strength of the patient, the motivation of the patient. We normally suggest you to do muscle strengthening exercises from before the surgery itself. Once you are regularly doing the muscle strengthening exercises before the surgery, the recovery is really fast after the surgery also. Person is walked from the very next day of surgery. Before discharge, one should be able to go to washroom, sit on commode, sit on chair, climb few steps stairs, and the full recovery takes around 1.5 to 2 months. Normally, people join office by 1.5 to 2 months. Whether we do one knee or both knees, the recovery is almost same. Of course, if you do both knees, the recovery is slightly slower than doing one knee. Now, most of the people, they think that they have to get the best implant to get the best results. So they are very specific that I need this implant. People do internet searches. Well, the implants that we use, or rather mostly use, they are all standard implants. They are all FDA approved implants with survivor feedback follow-up. Now, we must understand that knee replacement, like any other joint replacement, is mechanics. It is mechanical precision. It is the physics that is more important than the brand of the implant. The precision that is more important. Hence, the surgical expertise is the single most important thing. All the implants are almost same, and it is the surgical expertise which is the most important thing. It is the millimeters, degrees, balancing, the precision that leads to good results and survivorship of the implant. So it's all about precision. It's all about mechanics. Now, there are other factors also which we have to keep in mind. If you are motivated, you will recover faster. If you do exercises better, you will recover faster. So your own motivation, determination is something which is going to determine your speed of recovery. Now, because this is a foreign body that we are putting, this is an implant which is a foreign body we are putting. So it has got some inflammatory response, which is characterized by some amount of redness, swelling, heat to variable degree, and it takes a couple of months for all this to subside. So the full recovery takes around a couple of months, although one will be able to walk with a walker from the very next day of surgery. Now, whether we do one knee or both is a single sitting, it is a mutual decision. Both of them are very good options. And before surgery, we do a pre-operative fitness assessment, which includes various tests to establish one's fitness for surgery. We do a blood test. We do basically full body checkup. And then we go ahead with surgery after anesthetist sees our patients, which is known as pre-anesthesia evaluation. To keep the surgery as painless as possible, we use multiple ultrasound guided nerve blocks, multiple newer techniques have come up. We use transdermal patches and multimodal pain control procedures. And presently we have been using robotic arm assisted surgeries. Robotic arm assisted surgeries are very good because they need to enhanced accuracy, better predictability, better biomechanics, and most importantly, we can plan the surgery before the actual surgery. We do a simulation wherein the artificial intelligence of the robotic system shows the placement of implant, and then we have option of changing it or accepting it, and we do a complete planning of the surgery before the surgery itself, and it is reproduced during the surgery with continuous feedback mechanism. So that leads to better results, better survivorship, and better outcome of the surgery. We can assure you that we are doing the world's most advanced knee replacement surgery right here in Kolkata with the team of Momentum Orthocare. I personally have been doing knee replacements since last 18 years, and presently we are doing more than 400, 500 knee replacements in a month. So we have been continuously analyzing our results. We have been doing gait analysis, the way person walks after surgery. We have been continuously analyzing. We have been collecting all data. We have been improving ourselves continuously in all these years and decades. And we promise to give you the very best of knee replacement surgery right here in Kolkata. I and my team of the Momentum Orthocare promise to give you the very best right here in Kolkata. Thank you so much. If you have any queries, you can WhatsApp me at my number or mail me.